And then on the community health aides and the community health representatives, you know, this program that we developed, the CHAPS program, is something that we're really very proud of, and I think rightly so. So I'm curious to know how the CHAP program expansion impacts. So what you were proposing, how is that going to impact the currently funded CHAP program in the state? Will we see any impact from what you're doing nationally on us? And then also whether this extension that you're proposing encompasses certification or expansion for dental health aid therapists, similar to what we're using in Alaska.
With community health representatives and CHAPs, appreciate all of the history of the CHAP program in Alaska. It's touted as best practice, and many of the tribal leaders there in Alaska are very proud of their program. I think that the impact will be, if anything, positive as we expand into the Title 48 and we start to realize some synergies with the entire Indian healthcare system using CHAPs. We know that Congress has made it very clear there's to be no negative impact to the existing CHAP program in Alaska. So we've been cognizant not to burden them with the limited training capacity that already exists. We have definitely borrowed some of their experts to inform our process as we move forward and how they set up their training and how they set up their certification. We want to replicate as much as possible that great program. So the expansion is meant to be supportive, and hopefully with a larger program, we'll have more synergy. I would like to ask Dr. Todt, who oversees the CHAP Tribal Advisory Group, I guess not directly, but in our structure, he has oversight as a clinical lead. Anything you want to add on CHR CHAP transition and the work with Alaska?
Yes, thank you, Senator. Certainly, the community health aid program has been demonstrated to be successful, sustainable, and culturally appropriate in Alaska, and we want to replicate that success outside of Alaska. We will make sure that the implementation in the lower 48 has no negative impact and is not taking from any resources that are provided to the CHAP program in Alaska. That's paramount for us. The community health aid program, Tribal Advisory Group, has been advising us on development of policy, and that policy is nearing the point of us going out with consultation for tribal input. And then we intend to implement the community health aid program, expanding it outside of Alaska, and set up those governing bodies and the certification boards so that those processes are replicated in an area-like fashion, similar to how it's done in Alaska. We are heavily drawing from the successes in Alaska, looking at adopting much of the training materials, because we really see it as best practice. And we recognize that it will need to be tailored and adapted for use in other regions where there are different health needs and health systems in place. But having those extenders for physicians through the community health aid providers, extenders for behavioral health through the behavioral health aid providers, and extenders for dental care through the dental health aides, including dental health aid therapists, is very important for us.
Well, it's a point of pride for us in Alaska that we really created that program out of necessity, and that the training that went with it was truly grassroots. You mentioned culturally appropriate. It was because it was designed by so many who lived in the village that they worked in and knew the needs of their community and trained themselves and others for that. So to be able to go out to a village and speak with a community health aide who helped develop the curriculum and the training, they're still in place and still working on it, makes me pretty proud.